Hi everybody, today we're going to be talking about bariatric surgery. This is something that I've studied in my master's research thesis. So I have spent a lot of hours looking at bariatric surgery, interviewing participants and understanding how decisions are made to opt for surgery. So what we're going to discuss today is what bariatric surgery is. In effect, bariatric surgery is just not about losing or helping a person lose weight. It's called bariatric because it helps with metabolic disease or such as type 2 diabetes, cardiovascular disease. So that's why they call it bariatric surgery. Now, what type of surgeries are there? Well, there's probably three most common ones, and that is the laparoscopic gastric band, which is a little band which isn't performed as much as it used to be. It used to be really quite popular, and a little band was placed on top of the stomach to restrict food. This band could be removed once the patient had actually lost the amount of weight that they wanted. So that would be removed and they would have learnt good eating behaviour and things like that. It was not a permanent thing. The second one is the laparoscopic gastric sleeve, and this involves removing 70 to 80% of a person's stomach. So 20% is left behind, so less absorption, it's restricting in the volume that you eat, and it's increased in popularity because it's more effective. Patients in the first 12 months have a huge weight loss, because the procedure's been practiced and now it's done laparoscopically, there are less risks that are involved in the actual surgery. So it's considered more safe than once was. So there's that one, and that's predominantly the predominant bariatric surgery performed here in Australia, as well as the US and Canada. And the third procedure is the Roux-en-Y, which is where the stomach is actually bypassed. So any of these procedures, it is a good idea to have your consultation with the surgeon, with the nutritionist and with the psychologist. And having these people follow up on you for at least 12 months post-operatively ensures that you get a really good result as well. The best result, in fact, is obtained by the people who do this. So how much is bariatric surgery? Bariatric surgery costs anywhere between $16,000 to $18,000 Australian, and is covered by your private health fund if you are a member of one. However, there are out-of-pocket fees with that, anywhere between $6,000 to $8,000 in out-of-pocket fees. And these add up, and sometimes these aren't mentioned at consultation, but this is what participants in my master's thesis, in my research thesis, actually experienced some inconvenience in being able to pay this amount, and they weren't aware of many of the costs. So this is something that when you're choosing or looking at or deciding what to do, is to be aware of out-of-pocket costs or expenses, because they do add, even if you are covered by private health insurance. So the other way that you can have surgery, there's private health insurance. You can apply to your superannuation fund and they will release money for your surgery. You can have a personal loan to be able to afford it. Then there's also the public health system. The public health system, there is a wait. There is quite a quite an extensive visiting and with referrals, etc., and can take up to 3 years. So So what I found in my interview with the participants in my study is that once a person had actually decided to have surgery, they actually wanted to have surgery quite quickly. Even if they joined a health fund so that they could have their surgery, they would wait the 1 year, and as soon as the 1 year was up, they would have their surgery and then opt out of the health fund. So I guess for the private health system in Australia, this means that there is an added burden, I guess, where the private health system bears the brunt of obesity here. So here in Australia, the private health system bears the brunt of obesity because there's not enough money channeled into the public health system to actually fund and pay for obesity surgery or bariatric surgery. So why do people choose to have bariatric surgery? And this was the question I asked. And here are some responses. These are direct quotes. I've got to take a concerted effort because I wanted to be able to be a mum for a long time, not a short time. Another response was, I'm 32, I'm not getting younger, I'm just getting bigger each year. My bones are deteriorating because of the extra weight. It's starting to get out of control. My blood pressure's been increasing each year as well. And then another participant said it like this: when I hit my 50s, I really started to feel some actual medical complications. I started to struggle up a flight of stairs. I was worried if I had to negotiate a hill, those sorts of things. I'd get short of breath, really easy on exertion, and I had to go into blood pressure medication and medication for reflux. So it's really starting to affect my life in a physical way. So the two reasons why people or participants in my research study, and this is validated by other research that has occurred in literature, is that one is to improve the person's lifestyle, and two is to improve their longevity of life. So they're the two reasons why people opt to have bariatric surgery. Now, the concern is that the information which is obtained for surgery is often from social media and online forums, and there is a place for this. I am a health channel, a health, well-being, travel, lifestyle channel, and I'm doing this because of the results that I found in my research was that people will go to online and social media forums to find out information, and sometimes that information wasn't there for them or it wasn't complete. So that's the problem, having stories told and reading many stories. In fact, one of the participants actually said it like this: yeah, I would spend hours searching all that stuff, reading people's experiences and how they felt, like from before their surgery and after. A huge help having these online forums to go to, reading good stories and also the bad ones. That was a huge help. So there's definitely a place for online forums and social media to share experiences and for gaining information. However, the information needs to be valid and reliable, specifically when you're choosing to change your whole life by having surgery. So you need to know and consider the impact that having this surgery could make. Is it effective? Is there an expiry date on my weight loss? What will happen afterwards? Will I need to have body sculpting for skin folds, whether they be arms, legs, abdominal? surgery for removing skin folds, all those things. So these are the things that you need to discuss with your bariatric surgeon if that's the way that you're heading. What do I ask my surgeon? So some things that you could ask are, ask to speak to some of the patients who he's operated or he or she has operated on. They're the best source of information. They will tell you if they're happy, if they've been well cared for, and if they've had access to supportive services. Also, what does the bariatric surgeon's surgery offer? Many of them offer nutritional and psychological counselling, and this is beneficial and key to your outcomes and for optimal recovery and change of life in regards to eating and new behaviours. This is very important. The other thing also to consider is the out-of-pocket expenses. These need to be transparent and should involve things like the cost of a gastroscopy, the prep prior surgery, blood tests, medications, all those sorts of things. The consideration that you will actually need or could require, depending on your age and the elasticity of your skin, you may actually need body sculpting after your weight loss. So that's usually anywhere over a year after surgery. So these are the things that need to be considered, and remembering that your outlay for this surgery is between $16,000 to $18,000. If you're not happy, that you need to be happy with the decision that you make and the person that you choose. And often when we buy a car, we don't go to one car salesman, we go to 2 or 3 and we look around. So the same is in choosing a surgeon who you feel that has the required support services that you need, as well as being able to have a rapport with that surgeon where you feel comfortable in asking questions. And of course, as in anything, when you go to a surgeon or a doctor, if you can't remember to ask questions, write it down, a whole list of them before you go. Just a handy little hint there. Okay, so next week we're going to be talking about, does bariatric surgery, does it really work? Okay, so subscribe to my channel, ring the bell if you want to be notified of a new video, and I hope to see you next time. Thanks.